In lymphoma, some of the more common problems are inability to control the lymphoma with the transplant. This is especially true with lymphoma types that are considered high risk, such as diffuse large cell lymphoma, transformed lymphoma, T-cell lymphoma, Hodgkin disease. So these are some of the types of lymphoma that our investigators across the world are finding are more difficult to cure with transplant compared to some other diseases that are more amenable, such as CML or follicular lymphoma. So that's one problem in the lymphoma transplant field, is being able to get a sufficient graft versus lymphoma, immunologic response against the lymphoma to cure the disease. The other problem is, as you say, many of the patients that are referred for transplant, lymphoma is largely a disease of patients after the age of 50. So if you're doing transplant, I think the median age of our patients is over 50. These patients do not handle so well the conventional transplant. And because of that, we developed some alternative ways to prepare these patients for transplant, most notably by giving a lot less chemotherapy and using no radiation before the transplant. And we think that's important as far as keeping the patients relatively healthy going into the immune reaction that occurs after allogeneic transplant. So age is important, lymphoma subtype is important, and very important also is the patient's disease state. In other words, are they in a complete remission? Then the results can be much more satisfactory. Partial remission, doing very well there. If patient's not responding to chemotherapy, has bulky disease, progressive disease going into transplant, then these are the more challenging patients. Unfortunately, about over half of our lymphoma patients are in that latter category, not responding to chemotherapy, and these are the ones referred to our clinical trial. And we're getting some favorable results in that subtype. It creates a big challenge for the research, but I think is important because that's the reality: is patients aren't always going to be referred in the complete remission state.